Nurses are the epitome of compassion, comfort, and care even when there is no prescriptions. They are silent healers who work with their hearts, not just by their hands. Hello, and welcome to the another series of Human Behind the Healers, where we explore the life and stories of incredible humans who work in healthcare professionals beyond stethoscopes. I am Anusha Maratha, BSc Nursing fourth year student, passionate about learning about lives and stories of healthcare professionals who are shaping the world of medicine. This series honors the devotion, leadership, and advocacy of the humans who heal. Today, it is truly an honor to welcome Dr. Kristin Ferguson. Dr. Kristin Ferguson is a registered nurse, oncology certified nurse, and holds both a Master of Business Administration MBA and a Doctor of Nursing Practice. She is a healthcare leader who wears multiple hats in clinical care, administration, and policy. She is a Senior Director of Strategic Operations for Stem Cell Transplant and Associate Editor for Clinical Journal of Oncology Nursing, an international speaker and a dedicated health policy advocate with over 17 years of experience spanning oncology nursing, healthcare leadership, or health policy and hospital administration. Thank you so much, Dr. Kristin Ferguson, for joining with us here today.
Thank you very much for inviting me. I'm very happy to be here and looking forward to our conversation.
Welcome, ma'am. Before we explore your professional journey, let's know you in person. Would you please give us a short introduction to our viewers?
Absolutely. Hi, everyone. I'm Kristin. I've been a registered nurse in the United States for about 17 years. I live in Washington, D.C., which is on the East Coast of the United States. And I completed my bachelor's in nursing in 2009. After I completed my bachelor's, I became a new graduate nurse on an inpatient unit, which focused on surgical oncology. I spent about 5 years on that floor doing a lot of nursing, and at the same time, I obtained my master's in nursing. Then I switched to outpatient nursing in an outpatient clinic, a cancer center, where I focused on caring for patients with breast cancer. I worked as a nurse navigator, so a nurse that educates our patients about chemotherapy, side effects, and at that time, then I got my doctorate of nursing as well. And now currently I work with patients who have blood cancers, so like leukemia, lymphoma, and multiple myeloma. And I am a director of nursing for the program at my hospital. So I have a lot of nurses who report to me, as well as some non-nursing staff like administrative support, finance, and quality.
Thank you so much. You are actually wearing multiple hats, actually. Okay, you are also a nurse. I'm also a nursing student. It is the first question we always ask to a nurse. What inspired you to join nursing?
That's a great question. When I was younger, I was a babysitter for one of my neighbor's kids, and it's kind of funny because I did not go into pediatric nursing. I've always been into adult nursing. But one of the children, he had autism and some other developmental delays. And so I got to know the family very well by babysitting and becoming a nanny while I was in high school. So I was ages 14 to 18. Um, but during that time, I realized that I really liked working with people and especially getting to know their family, especially when they're having medical problems. And so that was one thing that inspired me. I would say the other was I was actually a volunteer with the American Red Cross, which is an organization that helps organize blood drives in the United States. And I remember going to volunteer in a hospital a few times. And I really liked the feeling of being in a hospital. I thought it was very clean and organized. I was very young. I was probably 15 years old. But these two experiences made me apply for nursing school and the bachelor's program that I attended.
Thank you so much. I guess you were inspired since your young years for nursing.
Mhm.
Yeah, but okay, I would also like to ask about oncology nursing. Why did you choose oncology nursing?
So in my bachelor's program, actually, most people were not interested in cancer or oncology. I would say I was one of the only ones out of 90 students that was interested in cancer. But as I was going through my clinical rotations, I rotated through pediatrics, through labor and delivery, through psychiatry, and I liked psychiatry, but I liked the idea of developing long-term relationships with patients and seeing them over and over in a very critical time in their life when they're very scared. And I found that oncology nursing combined what I liked about psychiatric nursing because you're doing a lot of emotional support, but then you're still doing a lot of technical skills as well. So in my younger years, I would say that's what made me most interested in cancer care and becoming an oncology focused nurse.
Thank you so much. Okay, when I was preparing for this interview, I was going through a CV. I also learned that you have done masters in business administration. Being a nurse, you have done masters in business administration. What has inspired you for doing MBA?
So my MBA is my last and final degree. I will not be going back to school, but I got my MBA after I got my doctorate. So I graduated with my doctorate in 2018, and then I only graduated with my MBA in 2023, so 2.5 years ago. And the reason I got it is because I am very interested in hospital leadership and hospital administration. In the United States, there are, different administrators from different backgrounds, but I would say a lot more physician leaders than nursing leaders. And I knew that I wanted to be a nurse that combined my love of healthcare as well as my love of nursing and really put them together to help be a leader in my hospital. So I felt that having the MBA with more technical skills like finance, business administration, operations would be very helpful as I work to lead my bone marrow transplant program and the cancer center as a whole.
Yeah, talking about the leadership, you have done MBA. What leadership abilities you have got or you has influenced you in nursing?
I would say that budgeting is very important. It's not something that is very much taught in nursing schools, even in my doctorate. But being able to look at a hospital budget and understand if you can hire an additional nurse or an additional nurse's aide, when you can afford to replace equipment, and how you're able to run the unit was very helpful because we want to provide the best quality, but we have to balance with the cost of care too. And so making sure that our doors stay open for patients, especially sometimes patients that can't always pay, is very hard to balance. And so getting the MBA helped me develop additional skills in addition to what I already knew from being a nurse and going through my nursing degrees.
Yeah, being a nurse, we must provide care to the patient, but we must also utilize the resources. Available resources are the most important for providing the care. So you also have pursued Doctor of Nursing practice, and we also have a trend of PhD as well. Would you please like to differentiate it, and also would you please like to tell about your Doctor of Nursing practice degree?
Yes. So in the United States, there are two types of nursing doctorate degrees, and I have the DNP. So a doctorate of nursing practice is different than a PhD in nursing, but both are considered terminal degrees. So the PhD focuses more so on nursing research, academia, and helping with creating new evidence for the nursing profession. Doctorate in nursing practice, what I have at DMP helps to help leadership skills with growth, sometimes business skills, although I still wanted more. That's why I went to get the MBA. But it's mostly for nurses who are staying in clinical practice, either as nurse practitioners in the United States or in leadership roles like what I have. And they're mostly using the evidence that PhD nurses are preparing and putting them into practice during quality improvement projects or utilizing methods to lower nurse retention and advance the nursing practice.
Thank you so much. So you have also done MBA and you are also much more interested in administrative works as well. So I would like to know the qualities of nurses should have in both clinical as well as in administrative works.
I think the number one skill or aspect that nurses should have is just curiosity. I think that being curious and looking to see what other people have done, I think is the first step in knowing kind of what skills are needed. I think there's a lot of overlap between nursing skills and business skills. Both involve a lot of critical thinking, a lot of studying, and a lot of talking to people. Both are very kind of social professions. I actually used to be very shy. And so when I was a new nurse or a nursing student, I used to be very shy. It used to be even hard for me to knock on patient doors and say, "How are you?" I thought, "Oh, I don't know if they want to talk to me. I'm just a nursing student." But the more I progressed in my profession, the more I realized that people do want to talk. And really, the best thing that you can do is be curious and ask questions. And so having a curious mindset, whether it's about your patient's health or about how the care can be improved from a business level or a quality perspective, is the first step that really helps both types of um, specialties, I would say.
Yeah, I guess being an administrative is actually for improving the quality of nurses as well as the quality of nursing care. Okay, let's move towards the professional question section. Talking about your journey over 17 years of experience in oncology nursing as well as nursing leader, what are the qualities you pursue or you expect from a nurse to be a nurse, be an advocate, or be a leader?
That's a great question. I would say definitely someone that's a hard worker. So willing to, look at education sometimes outside of working hours. I would say not to burn out, but having that mindset that sometimes you need to look outside where you're working, whether it's by reading other stories of what's going on, or going to conferences, or watching webinars, or even watching a web series like this. I think can be very helpful because you're able to learn a lot where you work, but then it is nice to touch base with nurses from other hospitals as well, and sometimes other countries and other areas to see how they are performing care. A lot of times we can get feedback or advice or generate new ideas by talking to each other. So what I've seen here, which is great, is that as nursing students, you really rotate through all of the floors here and all of the specialties. And I think that is so valuable. In the United States, for my bachelor's, rotated through a lot of specialties, but not as many as you guys do. It doesn't seem like it. And so I think you start with a really good base, and then you go from there and you continue those relationships, especially by being friends or colleagues, and keeping in touch with nurses from other floors. Because even if you're working in one area, there may be another area that has done a quality improvement initiative that your floor or your specialty can benefit from.
Yeah, it's a great opportunity for us as well. Yeah, okay, talking about your professional and personal level, it's been over 17 years. How has it been this journey as a nurse, as a leader, as an administrative works?
Sometimes it's definitely been challenging. When I was a newer nurse, I did a lot of rotating for my hours, like you guys are currently doing. So I worked days, nights, and weekends. And this was hard, especially in my younger years, because I was friends with nurses, but I was also friends with other people who had normal hours of working. So sometimes they would maybe be going out for dinner or having a fun time on a Saturday, and I had to go to work. And so that was stressful at the time. But I made sure that I was friends with other nurses, or that I would see my friends who were not in healthcare at other times. And it helped me create that work-life balance. But I think my first years in nursing were very challenging because I was trying to figure out exactly how to balance the sleeping and the working and being an adult all on my own. And then I also went back to school, so I was very tired a lot. But I learned after a while that you really have to prioritize things like sleep, exercise, seeing your friends outside of work, and then also talking with your nursing friends outside of work, just to so you understand how each other feels and you can vent about your feelings. And then I would say the longer I stay in nursing, the more I appreciate it. So I liked it a lot at first, but it's only grown the longer that I've stayed in nursing. I think it can be a tough profession, especially if you're working long hours or you don't like the floor that you're working. And it's also helpful to talk with other nurses, especially if they are on different floors, but on your same floor too, because then you feel less alone if you're having some challenges in caring for the patients or figuring out how to have a good work-life balance.
Yeah, good work-life balance is actually necessary to stay fit and healthy as well. You have visited our hospital as well, BPKIHS, and you have visited other hospitals or not? You
Yes, in
have?
different countries, yes,
Yeah,
and in the US.
yeah. So talking about the infrastructure and resources, how do you compare with ours and your settings? And are there any suggestions or recommendations for some improvements or in oncology as well?
I think the hospital setup, the fact that this is a medical city and everyone lives on campus and there's different students involved on the floors, I think it's amazing. I think it's great that you all rotate days, evenings, and night shifts, even though that makes it hard, but you get to see all sides of nursing. And your postings are good because you're able to rotate through a lot of sites. So in the US, our postings as nursing students are typically for like 4 to 6 months. So you get a little bored sometimes, actually. I would say I got a little bored during some of my rotations. But for you, they seem a little bit shorter, which is good because then you're able to rotate more. But the setup of the hospital, I think, is great. I've loved rotating to the different oncology units. I'm excited to see there's a new building being built. I know we don't know when it'll be finished, but I think when it's finished and the different cancer centers and wards are in the same building, that'll be amazing for patients and for staff. Because all the cancer patients will be in the same area and won't have to walk around as much for their care.
Yeah, we also hope that our oncology will expand more in BPKHS. Okay, you have been in the policy making advocacy of nursing as well.
Mhm.
So, what kind of policies are most important for nurses, or any policies you want to add in nursing?
So I've done a lot of work in the U.S. In advocating for our healthcare system in the U.S. to have better financial coverage for cancer patients. I think it is helpful for nurses to share their experience with patients and but with legislative members to show them the stories of patients that have been impacted by lack of financial coverage. For nurses, I think it's important to have support to go to educational conferences and webinars and have some of that supported by the hospital if possible. And so at a local level, I advocate for my own hospital to support that education for nurses that I manage because I think it's very important to do continuing education.
Yeah. So in Nepal, we also have a new policy about continuing nursing education for the
Mhm.
renewal of license.
That's great to hear. I did hear that earlier, and I think it's excellent. I also heard that every 15 days, continuing education is being done for the oncology nurses, and sometimes the nurses are teaching and sometimes physicians are teaching. I think this is a great collaboration and something I actually want to take back to my hospital in the US.
Yeah, it's giving such opportunity for updating our knowledge as well from the continuing nursing education. As you speak nationally and internationally, what are the issues of nursing you want to highlight?
I would say it's not an issue, but the more that I travel and I meet nurses from different areas of the world, the more I know that nurses are very similar in our passion for our patients and in our drive for more education. So nurses are usually excited to meet other nurses. I know I am. And this is definitely one of the highlights of my trip, talking with you both. And it's just very exciting to meet other nurses and connect. And so I would say, not necessarily an issue, but something that I think is great is connecting on social media or being able to stay in touch because sometimes then you're able to send a message through WhatsApp or through email asking if another person has a resource that you need, such as a hospital policy or a webinar maybe that they've seen that they can share. And I think that can be incredibly helpful in connecting the global nursing workforce.
Yeah, communication is the most important part in nursing, and communicating and connecting with other nurses, it will be the great for every one of us, I guess. Okay, let's move towards the personal section. So, being a nurse, what has been the challenges and as well as what has been rewarding in your career as well as in your life?
So I will share, I had been a nurse for 10 years, working in oncology. So my whole career has been in oncology. But in 2017, my mother was actually diagnosed with pancreatic cancer. And this is everyone's worst nightmare. In the US, and probably here, but I know at least in the US, pancreatic cancer has a very low survival rate. It's one of the worst cancers you can get. And so she was diagnosed in 2017 and she passed in 2019. So as for me, it's always hard being the caregiver, the primary caregiver for a parent with cancer or any one of your family members with cancer. But I felt it was also challenging because I knew a lot about cancer. So then I could see everything happening from a very close level. So on one hand, it was better for my mom because I knew exactly how to educate her, make sure she's taking meds correctly, be there for her. I knew a lot about what was going on versus maybe a different family member who doesn't know much about nursing or healthcare or cancer. But it was hard for me sometimes to separate being a nurse and being a daughter. But even though that was one of the most challenging times in my life, it's also inspired me to continue working in oncology. I think some people might be scared after that and say, I want to change specialties. But for me, it made me even more passionate about working in cancer care and working with nurses to build up the workforce and the education around cancer. Because likely most people in their lifetime will know someone with cancer or may get cancer themselves. And so because it's one of the most common diseases out there, it's over 200 types of cancer, but it's also inspired me and driven me even in times when I've felt very tired or maybe wanted to, I wouldn't say switch careers because I don't want to switch careers, but I would say it continues to inspire me and it's a story I share because I think it's one that a lot of people can relate to.
Yeah, thank you so much. Hearing a story, I'm sure you are one of the strongest person. Okay, I would also love to share my story. My grandfather was also diagnosed with a lung cancer. He has also passed away. So that has actually motivated me to join nursing, and actually I have so much interest in oncology because of that. So it has also inspired me to join oncology student wing as well as in nursing.
That's great.
So yeah.
Thank you so
Yeah.
much for sharing. I think so many people have that story and I think, your love for him and your memories will continue to motivate you.
Yeah, even I was not a nurse or any medical professional, and so I felt the actual importance of being a healthcare professional in a family. So it always motivated me. So when nurses deal with patients and their families, most importantly, when a patient is diagnosed with a cancer, the family gets devastated. The emotional support is the most important. So being a nurse, what do you recommend for supporting a family and patient both emotionally as well as helping them to cope with everything going on?
So I always try to ask patients and especially their caregivers, their family members, how are you doing? How are you feeling? If you're able to catch a family member or their caregiver out in the hallway, maybe even away from the patient, they may actually be more willing to talk with you. A lot of times they don't want to talk in front of the patient because they don't want to stress out the patient by saying that they are stressed out. But a lot of times they really are very, very tired and stressed out. So allowing them to talk and seeing what questions they have that they may not feel comfortable asking in front of the patient. A lot of times they may want to know the prognosis, so they want to be able to prepare themselves. They may also need help. They may have questions about finances or psychiatric help for themselves that they wouldn't share in front of their family member or their person they're caring for. So in the US, we have support groups also sometimes. So we will link up caregivers to talk with each other. and to come together and vent and share resources with each other. Because sometimes just being able to talk and know that you're not alone is one of the most helpful things.
Yeah, being a nurse, you know, a single question, how are you doing? Are you well or not? It gives a huge impact to the patient as well as the family.
Mhm.
So outside of your professional career, what gives you joy? What do you do for enjoyment, for relaxation?
I love traveling, which is part of the reason I love meeting nurses from all over the world. And so a lot of times when I volunteer, like on assignment, what I'm doing here, I will also take a week of my own vacation to go around and see the country, and see, what things I can learn. I love learning about history. And then in my day-to-day life at home, I love exercising. So I've shared with a lot of people that I have a goal this year. My New Year's resolution for 2026 is trying to get 10,000 steps a day. So I've been doing a lot of walking. And then at home, I also do a lot of yoga and working out in that way. And spending time with friends, I think, is very important in my family. My sister lives close by, so I'm very lucky. I can see her a lot every week, in between my hospital time. And I like cats a lot. So I had a cat for 15, 16 years and she passed recently. But my plan is now to go back when I go back to the US in a couple of weeks. I plan to get another cat.
That's great, actually, and best of luck for your New Year's resolution. So, what is the most important lesson you have learned from nursing?
I would say the most important lesson is that people are more alike than they are not alike. And that doesn't matter where you're from or your age. People all over the world and all over from all types of areas in the US, everyone wants to feel safe, everyone wants to be happy, and everyone wants to be healthy. They want to be able to live their lives independently. And so I really think if you're able to help support them holistically as a nurse in their goals, then you are providing a great service.
Since our series focuses on human behind healers, so what does a healer mean to you personally or professionally?
I would say a healer is not only someone who addresses physical symptoms, but also emotional, spiritual, and psychiatric symptoms. I think that because nurses are the healthcare workers that spend the most time with patients while they're giving medications, they can also do at that same time when they're doing procedures or giving meds, having a conversation that lifts the patient's mood or spirit, and also maybe provide education at the same time.
Yeah, thank you. Last but not the least, being a nurse, being a leader, being an advocate, what advice would you like to give the young nursing students who wanted to pursue more in oncology nursing?
I would say that there is a space for any nurse who wants to go into oncology nursing. There is a lot of options and a lot of roles. So it doesn't just include working on the inpatient unit, although that's a big part, but there's also the outpatient clinic or the day clinic. We call it in the US infusion center, but it's working with patients when they come in for therapies. It can be working in radiation oncology if you're at a hospital that has radiation. And then some countries have what's called nurse practitioners. So these are nurses who actually prescribe medications, therapeutic medications, supportive services for patients. But I would say that it's such a broad field that there is a space for everyone who wants to consider working with cancer patients.
Thank you so much. Hope I will pursue it.
Thank you. And thank you so much for inviting me to speak today and for recording this.
It's been an honor to hear your journey, both professional and personal. Thank you so much for sharing your experiences and insight with us today. To our listeners and viewers who have tuned the human behind healers, remember behind every white coat there is a human with stories and experiences. Remember behind every white coat there is a human who heals everyone, who has their own life, own stories. And thank you for sharing your insights. Thank you so much, Kristin Ferguson.
Thank you. Thank you so much for inviting me to be here, and it's been a pleasure meeting everyone.
Thank you so much. Until next time, goodbye.